Everybody right to go? There are just 76 active cases of coronavirus in Victoria, with 3 new cases since my update yesterday. Of today's 3 cases, one is linked to the Northern Metro outbreak. They are a close contact and were already in quarantine. The 2 other cases are under investigation, and further work is underway to determine if they are in fact new cases or examples of persistent shedding of the virus from historic infections, as was the case with an earlier case. One was a previous positive and one was a previous close contact. So whether they are new cases, genuine new infections, or whether it is about shedding the virus over a prolonged period, that will be determined by an expert review panel that is meeting to examine those issues today. We will provide you with an update as soon as they've come to a clinical conclusion on that matter. There are 5 Victorians in hospital, and I'm pleased to say none of those are receiving intensive care. A total of 3,130,788 test results have been received since the beginning of the pandemic. That is an increase of 24,135 results since yesterday's update. And I thank, on behalf of every single Victorian family, can I thank each and every one of those just over 24,000 Victorians who went and got tested just around 24 hours ago. We're getting 99% of these test results back within 24 hours. It's such a powerful thing that you can do so that we know where the virus is, we can put a public health response around you, and we can stop you inadvertently spreading it to anybody else. These results are gold. They are absolutely critically important, and we thank everybody who's gone and got tested. And we have to keep those numbers up, we really do. They are critical in terms of us and our track and trace and limiting the spread of this virus, cutting off chains of transmission before they even start. That's critical to us, not only remaining open with these settings, but taking another step on the 8th of November and then further steps as we get towards a COVID normal Christmas and a COVID normal 2021 while we wait for a vaccine. The rolling average to 28 October is Metro 2.4 cases, regional Victoria 0 cases. Cases classified with an unknown source, or that is to say mystery cases, there are 4 of those. They are all in metropolitan Melbourne, and I think the Chief Health Officer's release will speak to that additional mystery case. I don't have a background briefing on that as of right now. The 3 additional cases are noting that 2 of those may well be shedding rather than new infections, but they are, for the purposes of clarity, they're in Darebin, Burundara and Casey local government areas. There are, as I've said, no active cases in regional Victoria. There are just 4 active cases that are linked to residential aged care, which is very important given the inherent vulnerability in that industry. They're probably all the numbers of the day that I needed to take you to. I will just speak briefly about the hotel quarantine inquiry. The Board of Inquiry wrote to me last evening, I think around 6 o'clock, putting it to me, asking basically that they split their reporting into 2. So one report on practical matters that relate to the resumption of hotel quarantine, that will be with the government next Friday the 6th, and then a second report dealing with other matters will be with the government on or before the 21st of December. That is the request that's been made. This is an independent process. It's a Board of Inquiry charged with a very important task, and there was no sense in my mind that we wouldn't agree to the request that they had made. This is entirely a matter for them. They need more time. The government has given them more time, and I'm confident they'll use that time well to provide us with a report that sits squarely against the terms of reference that we have given them. Beyond that, this is another good day of low numbers, and it may be that there's just the one new case, given the other 2 are under investigation by that expert clinical panel. There are some complexities, though, with the one case that we know to be a definite positive, and there's been some knock-ons in terms of contacts and their contacts. I'm joined today by Professor Ewan Wallace, who many of you will know, both from his role both in clinical education and, of course, providing the very best of care to mums and bubs out at Monash Medical Centre, and then more recently as the head of Safer Care Victoria. I might just ask Ewan to come onto the stage and speak to you about that one case, which is a very small Victorian, very young Victorian, and some settings that have been impacted by that positive case. And then, of course, we're happy to take any and all questions that you have.
Thanks, Premier. Morning, everyone. So as Premier says, 3 new cases reported this morning. 2 we think are either historic cases with shedding, and as Premier has already outlined, are now the subject of our expert panel review to determine whether they are historic cases or new cases. The one new case that we are certain of as a new case is a child who attended an early learning centre, the Good Start Early Learning Centre in Bundoora, Plenty Road, and the Department of Education has the Early Learning Centre already on its website as an exposure site. So the child attended there on the 20th to the 22nd of October. Her mother was identified as a case on the 25th, and the child was quarantined from that day onward. The Early Learning Centre was closed from the 25th and has already undergone some cycles of deep cleaning, and will reopen when the outbreak squad is happy that the deep cleaning is satisfactory. The child has self-tested negative on the 26th of October, but was retested on the 28th and was tested positive. So there are about a dozen close contacts. 8 children and 4 staff. We have results back from 6 of those 8 children and 3 of the 4 staff, and happily they are all negative. We're awaiting the other results today. In total, though, there will be about 90 and perhaps a bit more now secondary close contacts, and they are now have been notified over the course of yesterday and today, both through the Early Learning Centre and through our contact tracing teams. There are testing already underway yesterday by Austin Health, more testing coming by Austin and the Children's. Some of that will be pop-up sites, and there's a menu of options, as you know, available to families who will be caught up on this. So drive-through testing, at-home testing, or testing in one of our pop-up sites locally or in our hospitals.
Happy to take any questions you have.
So, just on the point of inquiry reporting date, will that push out any plans to bring back in international flights?
Well, pleasingly, with the split that the board has determined to make, so those practical matters around a new model for hotel quarantine coming to us next week, that shouldn't be the case. That means that we'll be able to hit the agreed target that we have agreed at a national cabinet, and that is to have flights returning, to have people reunited with their families for Christmas. That's exactly what we want to work towards, and with no slippage or no change in the reporting date for that element of the work the board is doing, we'll get that next Friday. We'll consider it in some detail, and we'll make announcements shortly thereafter, I'd think, about the model that we're going to put in place, and then that'll mean we've already had, given that this has now been confirmed as being a 2-part process, I think there'll already be discussions, if not happened already, they'll be happening throughout the course of next week with Melbourne Airport and with others, just to make sure that we're ready to be able to stand up a new model. Of course, this is subject to whatever the board gives to us. We'll have to wait and see what the nature of their recommendations are. There may be options, there may be all sorts of different things that they go to, but what they've announced, what they requested and what I've agreed to, and what they've announced this morning shouldn't impact us having those flights back to Melbourne as soon as we possibly can.
So how quickly, I know you don't know what they're going to recommend, but how quickly do you expect to be able to turn that around? Are you aiming for sort of the middle of the month? Or?
Yeah, I think it may be a little bit later than that. Again, I think this needs to be done with a good deal of care, and it needs to be done properly, and arguably the situation in many parts of the world today is worse than it was back in March. So I think if I can't quote you a number, but I think that the New South Wales government has had a bit to say in recent days about the percentage of return travellers that are returning positive. So they come back to the country with the virus. I haven't got an exact number, but I'm certain that that's been a feature of some commentary from the New South Wales government recently. And that isn't a great surprise when you think about 80,000 cases a day in the United States, many parts of Asia with a set of circumstances that are profoundly more challenging and worse than they were back in March, April. and many parts of Europe as they head into winter that are reporting those numbers, similar sort of numbers as well. So we need to do this properly, and we will, and we need to look at what's in that report. But as soon as we can safely have that system set up and have those flights returning, we will, and I'm very confident we'll be able to have that well before Christmas. But I think it's probably toward the end of November rather than the middle, I would think. But you're right, I think, in your question, just to confirm, we do need to see what's in the report, and that'll be obviously something we can do from Friday next week.
Premier, the inquiry said this morning that several documents and affidavits they've requested are outstanding, and that may lead to further inquiries. Do you have any idea what those documents and affidavits are?
I can only speak to the requests that have been made of me. There was an affidavit and some, for completeness sake, questions that were put to me. We complied with the timeline, which, if memory serves correctly, was last Thursday or maybe Friday. But we certainly delivered all of my material back when it was there, and if they need further information from me, I don't for a moment think they do, but if they did, then of course we would comply. I can't speak to whoever else has been asked, and whether they've been asked questions and what they've been asked. The Board of Inquiry might be able to do that for you, but certainly from my part, we have complied and handed up all the different answers that they needed to the questions they posed.
Has DHS handed over all the documentation that was requested from them in the secondary request from the board, and has that led to the delay of the second?
I'm not certain. You'd need to speak to the board about that. I don't want to be a commentator or a spokesman for them, but I do know that there was some supplementary material requested, and I'm not certain whether the deadline for the production of that material has actually passed. I think there might still be time for them to. They can of course deliver it early, but I don't think they're beyond time, Alex. But I can't. I think it's fair. I can't be a spokesperson for the board. They might be able to speak to you about what they've asked of whom, and what the reporting or what the timeline is. But I don't believe they are behind time. But it may not be till next week that they have to produce things.
Sorry, can I just ask on return travellers? A couple
Yes.
of weeks ago, National Cabinet decided to expand the number of return travellers it would be accepting.
Correct.
Given the changing circumstances across the globe, I guess, will you be reviewing that, and will you be, accepting even fewer travellers?
Oh, look, I think it's one of those things that's demand driven, and we made estimates as a nation. All of us made estimates off the best of advice earlier in the year, and I think it was fair to say that we all finished up receiving more people coming home than we had thought. It's a bit difficult to be absolutely certain of how many people want to come home, but I think logic tells you, as conditions deteriorate in literally every other country in the world, barring a handful, there may well be more and more Aussies who want to come home and be with their family. That does present some significant challenges, and I think that I'm more than happy to look into that issue around New South Wales, but I'm certain that they've made some comments in recent days about the percentage of COVID positive passengers. It'd be fair to assume that we will potentially have more of them, and they'll be wanting to come home to be with their family, and they'll probably also wanting to come home to be part of the best, not just public health response, but the best personal health response from an acute care point of view as well.
So does that make it more important to accept those return travellers, or I guess, are you hoping to review the number of people you accept and drop that to even fewer?
No, I've got no expectation that number would go down. There were caps that were put in place. We're grateful to other states who are playing their part, because we're not in a position to do that, and if circumstances were to change in another jurisdiction, we would step up and do that work just as they have. In terms of the challenges posed by the fact that as we're getting to very low numbers and being in a very different set of circumstances as it relates to this pandemic compared to the rest of the world, that does present some challenges. But look, I've been in complete agreement with the Prime Minister all the way through this, that the right of Australians to return home is something that's very, very important, and we all just need to push ourselves further and work harder to make sure that we can facilitate as much of that as we can. But it's not going to be easy. It doesn't matter what international conditions are like, it would never be easy, but I think it's going to be a challenge that'll be at a higher order.
Have you had any discussions with New South Wales about the reopening of the state border? Because the indication from the government there seems to be they want to make sure Victoria's systems are operating properly before they do that, including return travellers in hotel quarantine. So
Yeah, look, I've seen some commentary from them. I've not had a conversation with Gladys. It's not. I think it's pretty clear they've made it. They made it abundantly clear, both Gladys and her government, that they want to see how things unfold in the next little while. I don't think that's an unreasonable thing. I wasn't particularly surprised to read that. I'll probably have a conversation with her in the next few days just about how we think things are going. The other thing too is that the chief scientist, Alan Finkel, has been moving around the country. He's visited every single state and territory. He's got a really close and detailed knowledge of the contact tracing and testing regimes in each and every state, and he's made some very positive comments about our contact tracing and our testing framework, and I'm very pleased about that. That should be a reassurance and a comfort to everybody, and we will work through these issues. I get along very well with Gladys. We've got a very important partnership, and we'll get that border open when it's safe to do so, and that'll be, I can't give people a date today, and I know it's very frustrating, particularly for border communities. And I know that dynamic pretty well, having grown up not far from that border myself.
On that point, she's just had a little bit of a swipe at Victoria, saying it's easy to have 0 cases when you're in lockdown. That's a direct quote.
Well, with the greatest of respect to Premier Berejiklian, there's nothing easy about lockdown, and there's nothing easy about what Victorians have been through, but I'm not really interested in having a debate with her or anybody else from this podium, frankly. We'll have a conversation. I'm very grateful for the support we've had from New South Wales, and whether it be in bushfires or pandemics, we're always at our best when we work together.
A couple of days ago you mentioned that you were going to be having a chat to Premier Berejiklian on Wednesday. Did you speak to her yesterday?
No, because she made some comments about the fact she wanted to wait, and I've had a bit on, so I've been focused on getting that done, and a little bit like, we've been asked a lot of times about border arrangements, and I've been pretty consistent that the best thing we can do to get the borders open is to get our numbers low, and then to keep them low, and every Victorian's got a part to play in that, and given that she's made, I think, the perfectly logical point that she wants to see how things unfold, I haven't made calling her a priority in the last couple of days, but we'll probably speak in the next few days just about how things are panning out, and if there's anything they need, if there's any sense of, if they don't believe they've got line of sight of something that they want or they need. But I would have thought Alan Finkel, who's one of the most preeminent scientific leaders in our country, and the chief scientist no less, who has been literally to every state and territory and has got a very detailed understanding of what's going on in every state and territory from a testing and contact tracing point of view. He's made some favourable comments. They've been, those improvements, that position is hard won, and I'm very pleased that he's made those favourable comments, because he's the one who knows and understands what's going on everywhere else.
Just on the child in Bundoora,
Yes.
for you and for you, and are there any other children at risk? What's the sort of risk level, and what's the...
Well, there are a number of children that are close contacts, and as Ewan's just reported, we've got test results from the majority of those. I think 8 of the 12. They're all negative. We'll have the rest of the test results back, I would assume, today. And if there's any further update we can provide either in the Chief Health Officer's release or at our briefing tomorrow, we will.
Can you say how that child who tested positive is doing? Like, is it a mild case?
We've always got to be careful with privacy, but that child is not in hospital. That child is faring well. And we wish that family and everybody who's been caught up in this very well. I just want to make the point that everybody involved in this has done exactly the right thing. They've got tested, they've got retested. When it became clear that there was a potential for exposure at the childcare centre, they closed. There's been those multiple cycles of deep cleaning. We're very grateful to them.
Is it linked to the Northern Metropolitan outbreak?
Yes, it is.
Okay, so is it like is it a case out of that, and do you expect more cases to test positive, or are you confident most that come back negative?
So as I understand it, the child was a close contact of someone who was positive as part of those numbers we've reported up quite a few days ago. The dates go back, I think, to the 25th. So the person that the child got it from is not a new case. It's locked up in that northern outbreak as well, going back to the 25th.
What was the child's age, sorry?
I don't think we'd necessarily disclose that, but it's a small child. Not a school-aged child.
Was it secondary ring of contacts 90? Is it? I heard.
It can be as many as that, yes.
And
we're
a third
moving.
Ring here?
Sorry.
Is there a third ring involved here?
Well, there is the cases who have already tested positive. There are the close contacts, and then there are these 90 that go beyond that, and they're the people who've had not necessarily close contact, so 15 minutes face to face or 2 hours in the same room, but they will be by and large households of those 12 children and households of the 4 staff, if that makes sense. So it's a three-step process, and as just to bear with me for one moment, of the 8 children who've been tested, as they've tested negative, provided we're confident they didn't need to be retested, then the link in the chain of transmission is broken, and those families would be able to go about their business, and that's the way it'll work. So it's that same system that we've used, whether it be in Frankston, Chadstone, Kilmore, Shepparton, all the way through.
Just on the child, why was the child at the early learning centre? Like, should the child have been home and was?
No, the dates fully established that both the parents and everybody involved were doing the right thing. They didn't test positive. They weren't supposed to not be at the childcare centre. And indeed, as soon as the positive diagnosis was there, our system kicked in to make sure that as soon as the diagnosis was there, so in full accordance with the process and the rules, the childcare centre closed. People were notified of what they had to do, but you do finish up with more people come into that 3-step process as you get more data, and similarly, people are released from that 3-step process once you get data coming in that says people aren't positive. So this is a very good example of the system working as it should.
Can I ask Professor Wallace
Certainly.
a question on the 2 other cases? When were they close contacts, and when were they first diagnosed with COVID?
So two quite different cases. First case was a known case back in August, and the second case was a close contact, again back in late August.
And I think it might have been last week, the expert medical panel was also reviewing another coronavirus case who was first diagnosed with the case earlier on in the year. Is there an update on that?
I don't have that information with me this morning. Certainly the expert panel, we've kept them busy this past week or so, because there have been a number of cases like this, that there's uncertainty about whether it's a reinfection, a new infection, or whether it's a historic shedding, an old infection. And certainly, as you'll have seen in the numbers, that the findings of the expert review panel has meant that some cases that are recorded, like these 2 potentially, are then taken off the numbers, because the investigation has found that actually it wasn't a new infection or was a false positive or whatever it is, the material, the basis for the review panel to be meeting.
So with the other case that was diagnosed either last week or the week before, what stage of the investigation is the medical panel at?
I would think the medical panel has met and made its findings. Yeah.
But the result of that is not clear to me. We'll get you.
Well, yeah.
I think it has been resolved one way or the other.
Just on the child, you said that the child tested negative, then positive 2 days later.
Yeah.
Just to confirm that. So any of the other children that are being tested, are you expecting, or have you got more tests booked in with them for 2 days past, like to double check their diagnosis?
Yeah. So this goes to the complexity of this process, doesn't it, and the precision with which we apply it. So the Premier is absolutely right. The child went to early learning centre because it was not known close contact. There was no known case in the household, and when the case in the household became known, the child was then quarantined as part of being a close contact, and the early learning centre did everything that we asked them to do. So closed down, deep clean. We did early testing, so that's part of acquisition testing. So as you're familiar with this process over these past months, the testing of close contacts is on day 11, and it's really a testing to confirm actually you have never become a case yourself and you're clear to go into the community, return to normal life. And the reason for timing at day 11 is to give plenty time for the transmission, if it's happened, to then reveal itself, and then for the individual to shed virus. In addition to that, particularly in managing outbreaks, we often ask close contacts to have early testing as part of our acquisition investigation. Who was the first case in that household? Was it really a parent or was it really a child? Because if it's the child that's brought the infection into the household, then the next steps are quite different than if it's a child who's picked it up from a parent. Does that make sense? So this child is now a case, of course, so doesn't have any further testing, and will be cleared as normal cases are. If the child was still a close contact, then like all close contacts would have day 11 testing in due course.
So just to clarify, the parent of the child didn't know they were a close contact of someone within the northern cluster, but then when they tested, they did know?
Nope. So as soon as the person knew they were a close contact, they were quarantined and tested, and along with that, the family became secondary close contacts and were quarantined that day.
How did they know they were contacts? Was it from the department?
From our interviews.
Okay.
And the childcare centre predates that.
Just to clarify on the two cases that are shedding or reinfection, if they tested positive in August, can we just talk about how you rediscovered it 2 months on?
Yep, because quite, and again, there's some privacy issues here and quite different circumstances. But one of the cases has an ongoing medical condition and was required some further treatment in hospital, and as part of hospital admission was tested routinely, which then threw up a positive result unexpectedly. Has previously had a negative result, and the other one was about symptoms, onset of new symptoms, and so then again took themselves forward for testing exactly as we've asked every one of us to do, and the test was positive.
Was the case that's considered a close contact tested back in August?
No, so they didn't have day 11 testing back in August, and you might recall that day 11 testing back in August wasn't mandatory, and that has been a recent change where release from quarantine is dependent on a day 11 test, and if you choose not to have a day 11 test, then we extend the quarantine another 10 days just to be absolutely certain that actually you're not infected. So we essentially manage you as if you are a case, because that case management is a 10-day isolation.
The testing of people in hotel quarantine for hepatitis, HIV, could you give us an update on that?
Sorry, what?
The Safer Care Victoria made the announcement about the testing with those glucose kits. Just an update on that.
So, I mean, Safer Care, as you know, Safer Care is undertaking its review, and I think they're scheduled to hand down the findings of review in mid-December. So we'll await Safer Care's review.
Have you had any positive tests though to those, potentially bloodborne diseases from?
So I'm not involved in that testing regime. That's obviously they're being testing for other bloodborne viruses, not COVID. And so I don't have that information, and that will come out in the fullness of both the care of those individuals and Safer Care's review.
Okay. Would you be alerted though if there were any positive cases that came out of that?
No, I wouldn't, because at the moment I'm on secondment to Public Health Command and the contact tracing team, and Professor Keenan, who's the Deputy CEO of Safer Care, is acting CEO at the moment, and Anne-Marie is looking after that work and that review.
Yep.
Premier, I was just going to ask, this morning the Health Minister was asked about the status of the 3 cases, and he deferred all the specific information to this particular press conference. Is there any reason as to why Martin Foley wouldn't give specific details about cases?
Well, we have a series of reports that come to both him, me and a team of other people, and I do a daily briefing, and lest I have nothing to brief you on, it's best that we take the time to make sure we've got all the right information and we provide you with that detail. I wouldn't read any more or less into that.
Just on QR codes, there's a lot of talk among businesses that
Yep.
everyone's adopting their own, and it seems like a bit of a problem. What are we
Well,
doing
it's
about
important. I think it's really important that we get this right, and there are a number of different issues here. There's privacy, there's the security of the data that's captured, and then there's also making sure that we have perfect compatibility between the front door to the system, the QR code system, and the new database that we have built, the new CRM product that we've built. That's the product that essentially has been the subject of a lot of hard work and some very favourable commentary from Professor Finkel in just recent days. If you look at other states, they didn't necessarily go to a universal QR code platform on day one of opening. It will become, I think, more and more important as numbers get bigger, and we'll have some more to say about this, including all of those issues around privacy and making sure that data it's for the purposes of public health and nothing else. And I think people have got they've got every right to be not concerned, but to be mindful of those things and to make sure that we get those things right.
Is there a specific date yet when it will actually
Sorry.
be up and running?
I'll make some announcements soon.
Both the ACT and New South Wales have had their QR code systems up and running for more than a month. We've had all that extra time ahead of reopening yesterday.
Well, they've been open for a
to get
little more than a month,
ourselves
though, I think.
organised.
I think they've been open for a little more than a
Yeah,
little
but
more
they've
than
had the QR system
and
operating
they're
for
not
that
compatible
period.
with the brand new best-in-class database that we've put forward. I went to this yesterday and the answer hasn't changed.
Why couldn't we make sure that they were ahead of reopening yesterday?
Well, because they don't report to us.
No,
And-
why couldn't we have made sure that our QR code system, we've had,
Well,
we've had
I-
weeks to prepare for reopening yesterday. Why couldn't we
Well-
make sure that we had a QR code
Well,
system
I
that
think-
was ready to run by yesterday?
if there's some implied criticism in your question, I don't accept that. You've got to get this right, and getting it right is not quite as simple as just taking something off the shelf. When you've got the best-in-class IT system, and that's not my judgment, that's a judgment from people like Alan Finkel, who was at Senate estimates yesterday, I think, and has been all around the country. It's not a contest as such, but he's made very favourable comments, and I'm grateful to him. And he's worked extremely closely with us and very hard. He's a great Victorian, and I'm very, very grateful to him. But those comments are not for nothing. They are, I think, a really strong reinforcement that we do have some new systems and systems that we can be very much confident about. But you've got to get this right, and it's not quite as simple as taking something from another state or taking something off the shelf. You've got to get it right, and this process, I think we will, in fact, Rachel, if you were to compare the two pathways, I think we will finish up with a universal QR product well ahead of the equivalent point on New South Wales's journey, for instance.
Can't we roll out an interim QR code
Well,
measure?
we could, I could just try. I could merge all three questions into one if you want.
They might not be the same. Given Victoria's track record with IT projects like MyKey, Ultranet, I mean, there's a long list of abject failures. How can Victoria?
Well, thank you for that, Andrew. That's very good. I'm people in my government know and understand that I have a very low tolerance for IT projects that don't work. This has had some very special attention, and I would normally be a fan of buying something off the shelf because they're normally a less risky thing to do. However, when you build something that is new and fit for purpose and bespoke for us, and it's then judged to be the best in the country and one of the best in the world, it's appropriate that the different inputs, the different pathways into that system have to be perfectly compatible with that system. So I'm very confident, and it's not just me saying it. Alan Finkel has had some things to say, and others. This has been and the other thing is the data tells you a really clear story. We are not just meeting all the national benchmarks for testing and contact tracing. We are smashing them. We are well ahead of them. And I'll be really clear with you, we had a very long public health meeting recently, just this week, and we've had a number of other Cabinet Committee meetings this week, and I've asked people to go and rewrite all of those metrics. I'm not content just to pass through those gateways and to have a dashboard that's got all green lights. We want a situation where if there are new targets that we can put in place to, again, push us to do even better, and we'll have some more to say about that in due course also.
Is there any reason why we can't have an interim, not so perfect QR code system? At the moment, we don't have any. We're aiming for 100% perfection. Is 30% or 40% perfection not so?
Well, some settings.
It's better than nothing.
Yeah, but I don't think it is nothing. I think if you look at my conversations with the managing director of Wesfarmers yesterday morning, they've got a very innovative product, not necessarily one that we could ever have built, which is a pre-booking system. And I haven't got an update today, but I'm told that there was more than 100,000 people who had pre-booked to go and visit Kmart, whether it be in the very early hours of Wednesday morning or a bit later on in the day. So there'll be lots of different innovation. And then for some businesses, pen and paper will work, and they'll take that very seriously. But there'll be an ability, just as other states have done, to align, and indeed I think to be well ahead of bigger steps where we have larger crowds, more people moving through. We will be very well placed to not just meet what other states have done, but I think to be well and truly ahead of them, and I think that's a good thing.
As a result of the second wave of the COVID pandemic, we've been in lockdown for almost 4 months now. It's businesses have been severely affected. They were calling for themselves to reopen.
Yes.
Over the last day, we've seen widespread non-compliance with COVID-safe plans. People who are sitting too close to each other. Staff not wearing masks. businesses, it seems as though they're not following the rules. What do you have to say about that?
Well, there is a significant compliance effort, but you know, it is true to say that we can't literally have 100,000 people out there making sure these rules are followed. There will always be limits to how much enforcement activity you can have, and indeed in this very room there's been many questions to me about whether some of the tactics to enforce the rules have been, to use terms others have used, perhaps a little bit heavy-handed. I've never agreed with that view. But I just say, and again, I don't want the non-compliance in some businesses to detract from the amazing performance, I think, in the vast majority of business settings. But I just say this, there are fines, they are significant, and they will be levied. Everyone has to take this seriously. Everyone. Again, I'm not detracting from those who are, but you've asked me a very direct question, and, you know, it's not just your business, it's everybody's business. Because if you don't do the right thing in your shop, in your setting, in the choices you make, whether you be a customer, a worker, or a business owner, then you're putting everyone at risk. So there is enforcement, and I'll leave Victoria Police to talk about, I think specifically the weekend that's coming up as essentially a long weekend. Everyone has got to play a part in this. So we cannot do this on our own. You know, we can have professors, you know, from all over the world saying good things about what we're doing, and in fact we have that, and that's a point of pride for every single Victorian. But no matter how big the team gets, like, every Victorian has to be on that team, and they have to wear your mask and wear it properly, wash your hands and do it often.
Just on that,
all of those rules.
Ministers seen in Parliament sitting within their office within 1.5 metres of their staff members not wearing masks. There's been at least one minister from the government and at least one caucus member. Will you be reminding the members
indeed,
of your own team
everyone
that they
needs,
also applied to that?
Well, everyone, that applies to everybody, including in this room. And I've been asked by more than a few questions from people who weren't wearing their mask properly. I dare say at various points in the last few months, you know, all of us have not necessarily worn our mask as we should, but we have to. We just have to do this. And it's not, even though we've been doing this for a long time, it is sometimes difficult to keep your distance. But we've all got to strive to do the best we can, and that's why masks are really important, because they become that sort of ultimate safety net against some breakdowns in some of those other things, not being able to keep distance, and you know. But the most important thing, and you'll be unsurprised to hear me mention this yet again, but the most important thing is to get tested when you've got symptoms, and to get tested really fast. Not to wait a day, not to wait a weekend. You've got to get tested as soon as you register the symptoms.
Just on the QR code system, when,
Sure.
when do you think we'll actually have that ready?
Not
You keep saying
today.
you're ahead of everyone else, but when will it be?
I'm not here to announce that today, but as soon as I've got announcements to make, I will.
Talking weeks, months?
Yeah, weeks.
Can I just go back to the enforcement?
And if that gives rise to it's weeks away report, fine, but it's being done, but it's got to be done right. And there are some complexities to this. It's not just, like, you got to build something that's compatible with the very best IT system, but you've also got to give people confidence that the data's only being collected for the purposes of public health, that it's not going to be, they're not going to suddenly start receiving all manner of advertising material and things of that nature. So you've got to, because if people don't have that confidence, then they won't use it. There's also issues of cost. We don't want businesses to have to pay for this, and there's also issues about how simple you make it. If it's got to be an app that's downloaded, that's got to sit there choking your battery, perhaps it won't be on. We're not doing that. We're doing something different, and we think that it's going to be a really good product, and it'll be there in good time.
Can I go back to the point of enforcement? Who's actually enforcing these directions? My colleague, she contacted the Department of Health and Human Services, Victoria Police, WorkSafe, Emergency Management Victoria, and also the state government last night, and it just passed the buck to each other. And nobody could say which agency was responsible for enforcing these COVID safe
I'm
plans.
surprised to hear that. If you provide me with those details offline, I'll be more than happy to chase that up. I'm very surprised to hear that. Victoria Police are there to enforce the Chief Health Officer's directions. WorkSafe have a role to play if it's in a workplace, and authorised officers in partnership with Victoria Police have a role to play in that as well. So there are many people. There they're all working toward the same outcome. I'm very surprised to hear that, and I'm not pleased about it. So if you want to give me the details privately, I'm more than happy to chase that up.
So who actually enforces it? There's a cafe, customers aren't sitting 1.5 metres apart, staff aren't wearing masks. Who goes in there and actually hands out the fine?
It will depend on to whom the complaint is made. So if you ring the coronavirus hotline, then they will pass it on. And if it's a matter of VicPol, then it'll be referred to them. If it's a matter of business procedure and process, then it's conceivable that might be given to an authorised officer. And again, we don't necessarily turn up and just slap a fine on people. We will want to go and see that is in fact not in accordance with the rules, and we might also, depending on the circumstances, we might give the business some chance to a warning, if you like, to try and remedy that. And sometimes the business will have taken all reasonable steps, but it may be customers who are not, in fact, following the rules. So there is a little bit of complexity to this. I think the vast majority of people know that these rules are not against them; they're for them. They're for keeping us open. But I'm more than happy to follow it up if there's any need for us to streamline that. I don't want people making phone calls like that. I want people getting an answer as soon as they possibly can.
Level of complexity and the department's not actually knowing who's enforcing the rules and referring
let's run that to ground.
Does that not also go back to the point that State Controller Jason Helps made at the hotel quarantine inquiry last month, when he said that a complex, multi-layered decision-making structure in the program made it difficult to track the origin of a decision, the role of position responsible, and information, data or plans? Are we going to get to that point again?
I'm not here to comment on evidence that he or anyone else led to the inquiry. You could ask me about my evidence, but I'm not going to be a commentator on
complexity in decision making and the lines of responsibility, and we're getting the same thing again.
Yeah, but I think it's really important to acknowledge that some things in this are really simple, and other things in this are not simple. They have to be complex by their very nature, because what we're up against is complex. Not in every element, but in some it is. And this is not a matter of everyone can do whatever they want unless and until the police turn up, or an authorised officer, or someone from WorkSafe, or all three at once. Everyone has to play their part. And as I said, the rules are not there for any other reason than to keep us safe and keep us open, and allow us in about a week's time to be able to take another step, and then potentially take further steps weeks after
Can
that.
I just be absolutely clear?
On the specifics, though, I'm more than happy to chase it
Can
up.
I just be absolutely clear on the enforcement of rules? A hairdresser that's, not taking the contact details of someone, a cafe that's not following social distancing rules. Who do I, if I want to dob them in, who do I call? And which agency will enforce that fine?
You can call the coronavirus hotline, and if they can either direct you to someone, or they'll deal with the details that you provide them, and then the appropriate person will be dispatched to deal with that. And it might not be in person. It might be a phone call. We've received a complaint. This is what you're alleged to have done, etc., etc. We've done a lot of stuff online. So, for instance, a complaint about conduct at a hairdresser's will be treated differently to a complaint about conduct at a meatworks. They will absolutely be different, because there are different rules in place. There's a different framework in place, and and this again does add some complexity, there are some dedicated teams in a number of workplaces who've been doing this work for months. So there's not police that are going in and making sure that the massive Cool store out in the north of Melbourne has got the right ratio of staff, they're cohorting their shifts, they're not in the lunchroom together, all of that. That's very different to some of the more public-facing things. I would have thought that everyone knows and understands that Victoria Police do have a role to play here as well, but theirs is a public health and a public order issue as well.
So Victoria Police should be enforcing rules when it comes to public-facing, like cafes, hotels, restaurants?
Where it's appropriate, and it is difficult to give you a blanket answer, is what I'm saying. Sometimes that would be a matter for Victoria Police, and other times it won't be.
Moving on to families of coronavirus victims, some have expressed that they are upset with the celebrations online, which, although not your intention, will you speak to these families or contact them directly and apologise for the
Well, what I'd
unintended
say,
offence?
I would again, I'm grateful for your acknowledgement about my intention, and you're accurate to describe it in those terms. What I would say is I'll again, as I have done on a number of occasions, but I will again offer my deep and profound sympathies, condolences and best wishes to every family across Victoria who's lost someone. On Monday, when we made really important announcements, I did make the point that there has been not only a year of great achievement where people have stuck together and showed amazing kindness to each other and a determination and a courage, but it's also been a year of extraordinary pain and loss and hurt for many. There is legal action against the state of Victoria at the moment, and I really can't comment on any further specifics than that. But I again extend my deep, deep sympathies, not only from in my capacity as the Premier, but from my family to every family who has lost someone because of this global pandemic. I send my condolences.
Just on the annual report document.
Sorry,
done,
can
but-
we
Sure, Rachel,
this
go for it.
particular issue? Sorry. I've been told by the family of someone who died from coronavirus that they'd expected that as a family they might receive some ongoing support from DHHS. They've said, quote unquote, it really seems after your loved one has passed, you're just crossed off their list. What support has DHHS been providing to those 819 families?
I'd need to come back to you, but I'm more than happy to do that.
Premier, on the annual report document dump, at the risk of asking 10,000 questions that emerges from 64 documents, can I just take you to the contact tracing team? In the Department of Health's report, it says that the public health team only had 57 staff at the start of the pandemic. Now that went up to 1,800 by June. Is that a good position for the state to be in, to go into a pandemic with 57 staff?
Well, I've gone to this a couple of times, and you know, I've had the privilege of being in and around the health system for a very long time, longer than most. And I can tell you, if you were to maintain a public health team at, say, 2,600, which is where it is now, there won't be much elective surgery being done. There won't be much of anything being done other than public health. Like when you have a 1 in 100 year event, you need to scale up, and you scale up fast. And that's exactly what we've done. And I'll boldly predict that when this pandemic comes to an end, and of course that a vaccine will be central to that, at least in part. We don't know what sort of vaccine we're going to get and when we're going to get it, whether it's relevant for a percentage of the community, relevant for a long period of time, or maybe give some protection for a short period of time. But once those questions are answered, then I think the public health team will shrink, but it will be relevant to the task, and you'd always want that. Otherwise, you know, there are limits to how much funding there is in a global system, and of course, you know, health demand, not just public health, but health demand is unlimited. It is uncapped. But there are cap funding models. There are limits to how much money we can provide. I believe the team was appropriate. Because it flexed up, it grew rapidly because we were in a 1 in 100 year event, which of course we were not in 2019 or 2018 or 2017, or indeed the 4 years most recently where we were not in government.
And just, sorry, two other questions out of the documents.
Sure.
First one, executive pay for department secretaries and executives. The reports show that Chris Eccles, or the Secretary of the DPC, was paid up to $699,000 in 1 year. Does that pass the pub test for Victorians? Well,
there's a contract in place as far as for secretaries. As far as executives are concerned, those matters are dealt with by secretaries in terms of the people that they employ and the terms under which they employ them. We've made some significant changes, particularly as it relates to bonuses when it comes to this level of staff. But you can't have a massive agenda and deliver it ahead of time or on time unless you've got a very highly skilled team of people, many of whom in the private sector would earn substantially more, and many in other public sectors in other parts of the country do in fact earn many more dollars than that. There's an expectation they work hard and deliver outcomes, but many of those specific arrangements they're not settled by me. But the expectation is very clear from me that they all work hard and they all get on and deliver the things we said we deliver. Level crossings, TAFE improvements, new hospitals, new schools, family violence reform, mental health reform, and more recently, a pandemic response that in partnership with the Victorian community sees us opening again, which of course, again, with respect to anyone who has lost someone, with respect to them, we can, as a broader community, we can be positive about all that Victorians have been able to achieve.
And Premier, are you at all cross the Ombudsman's report into the abuse of children in state care? Have you been briefed on that?
Am I cross?
Yeah, I just wondered if you were briefed on it, because there's probably no point in asking the question if you're not aware of it.
I have a broad understanding of it, but I've not read the report. I will at some point. That'll be a subject of a brief that comes up to me, quite a detailed brief.
Can you offer any response?
All I can say is that this is a very challenging area. We know that consistent investment is the most important thing. We've invested more than $2 billion in this space, and not just more money for the same, but more money for reform and for change. I want to thank every child protection worker and indeed their families. It's a very challenging job, and I've been honoured to meet some along the journey, and I know that Minister Danella knows and understands the importance of consistent investment. But the advice of the Ombudsman, the findings of the Ombudsman, we'll look at those in detail.
This obviously falls under the DHHS banner, and there's growing evidence that the health system and the child protection system together in the one department is a lot of work. Is there any consideration to changing the department or restructuring it into two separate entities?
Yeah, look, Alex, we're always reviewing everything. I'm not here today to make any machinery of government announcements, but we always review all of the arrangements we have in place. And I dare say that not with any specific reference to that department, but in many different arrangements across government, across households, families, across businesses. 2020 has been a year where a lot's been learnt, things have become obvious that perhaps weren't. I think 2021 will be a year of change in lots of different areas. I'm not specifically referring to the arrangements you asked me about, but I think you've always got to have an open mind to these things.
November 10 has been added as a parliamentary sitting day. I'm assuming, does that mean budget will be on that day?
Not on that day. I think that'll be as best it can, given that it covers Remembrance Day. That will be a normal sitting week, with the exception of arrangements to make sure that we can all mark that very solemn day. The Treasurer will make announcements about Budget Day soon.
So you've ruled out November 10 as the budget
November
day?
10 is not the day of the state budget. As I said, the Treasurer will make announcements soon about when Budget Day will be, but it will not be on that day.
Has it been delayed at all by the reporting of the inquiry being
No, I've been asked this a few times and I've answered consistently and accurately, and the answer remains no. The budget is not a distraction from anything. The budget will be a budget like no other, and it's a big piece of work. And we've got to give all of our officials and all of our teams the time necessary to put together a budget that is unprecedented in size and scale, and the Treasurer will be able to confirm the Budget Day arrangements soon.
Premier, your government spent almost $2 million of taxpayers' money on research and advice from Labor pollster and strategist John Armitage's company Kudos. What did taxpayers get for that $2 million? Why has your office refused a request for details of the work that he was paid to do? And do you agree with Mr. Armitage's boast on his website that quote-unquote public opinion is a fluid thing that we can squeeze, pump and stir?
What's on a website that I don't think I've ever visited is not something I'm going to be a commentator on. In terms of monitoring where the community's at, what the community's views are, I would have thought that during a pandemic that was critically important. Not who they support and don't support. That's not the nature of this important work, and I wouldn't like to think that it had ever been the nature of the work that was done, whether it be by Crosby Textor under a previous government, not a Labor government, I might add, if that wasn't abundantly obvious. Mr. Armitage does important work, and it'll be reported on in the Department of Premier and Cabinet annual report, as it is every year.
actually go back to 2016, 2018, which is
got
nothing to do with the pandemic at
all.
all. So
I would have thought understanding what it is the Victorian community wants, what it is the Victorian community is concerned about, their priorities, was a very important part of the job that we have to do, and it has been custom and practice, I think, as DPC have confirmed, because they're uniquely placed to do this. It's been a feature of government's approaches to the trust and the important responsibilities they have, whether it be Labor governments or Liberal governments, for an extended period of time.
So can you just confirm, was that company involved in crafting your messages during the pandemic?
No, I don't have people craft my message, Rachel. I'm here every day to give you my message, which I craft, and it's usually, in fact, it's exclusively based on the facts and me being as frank and as honest. And I would have thought that you all knew me well enough to know that I speak the way I speak, and I'm not directed or crafted by anyone. And that might be to my detriment from time to time.
Does any of that
But
research,
but seriously,
does any of that research recommend certain language for you to use in person or online
no,
that people
that's-
respond to?
I think I've just answered that. You know, if you want to make me out to be some sort of Manchurian candidate, I don't know about that. Like, I guess
it's
I
quite
stand
common
up
in
here.
American
No, I
elections.
don't.
It's
The answer is
something
no.
that's done
The answer is
regularly
no,
now.
Alex. I stand up here every day, and I speak to you as someone who's been chosen twice by the Victorian community. Because I've been who I am and led the way I believe a leader should lead. Well, I'm not crafted or scripted. I get on and do the job as best I can, and people can make their own judgments about that. But it's, I think it's it is very clearly the answer to your question is no.
What about the crafting of the messages online on your Facebook? Because you obviously don't put up all of those yourself.
Well, there are a team of people who work to make sure that we get information out to as many people as often as we can. And we've never made any apology for the fact that there are some new media platforms. They are particularly good at engaging with people, and public information is very important, pandemic or no pandemic. And I would have thought the number of people who connect with those platforms would be proof positive of that.
Was it appropriate to award that contract to Mr Armitage's firm without a tender process? And given the political nature of the kind of work he does, is it appropriate for taxpayers rather than the Labor Party
Yes,
to foot the bill
completely.
for
It's
it?
not political work.
Premier, you alluded to it a little bit earlier. Did you catch Anthony Fauci's comments last night?
I didn't see them live, but I have had them drawn to my attention. And the point he makes is a very good one. If you wear your mask and you wear it properly, then you're playing your part. Just like keeping your distance, washing your hands, following all the different rules. Having visitors to your house, yes, but only one group once per day. And if they come to you, you can't visit anybody else. It's just a simple thing, one event per day. But that won't be there forever. But while ever it's safe and while ever it plays its part, we can have more freedom and more movement and a better COVID normal, if you like. And that's exactly what we're aiming for. And that's what Victorians have built. That's what Victorians have built. And there should be great pride amidst the hurt and the pain. There should also be great pride in the fact that Victorians have, in the strangest way, kept their distance but stayed very close.
Also open for lap swimming at the moment.
Yes.
So, the restrictions allow people with disabilities to do one-on-one hydrotherapy.
Yes.
Why is it a requirement for people with disabilities who would normally do their exercise alone to pay for someone, to pay like a health professional or a support person to join them?
I'm not certain, but I can chase that up.
You're
I'm not certain about that. Is that an arrangement at a hospital or at a
No,
public
no,
facility?
So
or
hydrotherapy sessions in pools, people with
Yeah.
disabilities,
where are the pools located? Are they part of a health service or a public arrangement? Or?
like public swimming pools.
I'm more
hydrotherapy.
than happy to chase that up. I wasn't aware of that, but if you give me the details, I'm happy to chase it up.
Will businesses that have sourced their own QR codes be forced to take on the government's system once it's up and running?
Well, we want to make sure that it can properly integrate as soon as possible, but we think there are ways through that. We're certainly not going to be charging people to do this, but it's not too far away. We'll be able to make some announcements very soon, and that'll be.
Work side by side with private enterprise QR code systems that we've got in place already?
We will certainly aim to achieve that outcome, yes.
Just on when you first knew that the virus was escaping the hotel quarantine, previously on the record you've said that you had the full report and were aware on June 30th when you announced the inquiry.
Yes.
It's now been revealed that the Peter Mac Institute handed up a full report on May 30th to members of DHHS, and that there may have been alerts to the government even prior to that of cases escaping the system. At what date did you first become aware that it could be an issue? Not in full or a full idea of it?
I'd need to go back and check when I was first aware of outbreaks at various hotels, and I think I probably would have stood at this podium and spoken about some of those outbreaks and probably asked questions about them. I would have been asked questions about them. In terms of reports from Peter Mac, the first I heard of this was when the Chief Health Officer advised my office, and within hours. Yeah, within hours. So that is to say.
You had no idea that it was
No. I would have known that there had been outbreaks, But the notion that it was going to was in the process of creating a second wave, I don't think anybody had clarity on that issue.
I'm not asking that though. I'm asking when you knew that the cases in the community were actually linked back to the hotels.
Oh no, that is the product of genomic sequencing. But in terms of outbreaks, so when I would have known about what was happening in hotels, I'm happy to come back to you about that. That'll be almost certainly that'll align with my public commentary. I would have, just like any other outbreak. So for instance, So
you definitely didn't receive any briefing between May 27th and May 30th that there were cases in the community that had resulted from hotel
so
quarantine.
just help me out here.
Between May
30th
27th
being the
and
day
May
that we
30th.
announced the inquiry. Is that right? Is that what you're saying?
No, June 30th you announced the
Right, no. Well, the answer I think is almost certainly no. The first we knew of the fact that the first we knew that chains of transmission that started in hotel quarantine were contributing to community cases, and certainly community cases at scale, was when we had genomic sequencing handed to us. But I'm more than happy to go back and check on when I would have first been made aware of various outbreaks. But the nature of outbreaks is that you're focused on, well, what you know, I suppose, index case, close contacts and spread. But the broader picture was only made aware to us when the Chief Health Officer told us.
You had no idea that the virus was escaping quarantine
No.
as early as May 27th to May 30th?
No. But I'm happy to check. I'm trying to be as helpful as I can. And I've kind of answered this question in a number of different ways I've answered the question in effect over a long period of time by making it very clear to you that the first we knew about this was only hours before I stood behind this lectern and announced a judicial inquiry into it, because that's when the genomic sequencing, or not the report, it wasn't like I didn't get boxes full of reports, I got notification from the Chief Health Officer that morning, that this was an issue. As far as, for the sake of completeness, when I would have known about outbreaks, which is very different to the notion that it's responsible for all these cases, if it's helpful, I'm more than happy to try and search back and find out when I would have been aware of those outbreaks.
Do you find it concerning that DHS had a report saying that there was issues with hotel quarantine a month before you were told?
I find it very important. I would determine that it is very important for us to wait for a process that's been established to get to the bottom of those matters and any other matters. I think it doesn't make a lot of sense to be trying to run the inquiry while the inquiry's running.
Do you roughly know how many primary and secondary contacts are isolating at the moment?
I don't have a number. Ewan may have a number, or given that he's looking at the notebook, we might take that on notice, and if we can give you a bit of a global sense in the Chief Health Officer's media release, we're more than happy to do that.
Just confirming, you said Burundara or Bundura? Because there's
Burundara.
Is it one on Plenty Road in both suburbs?
No, it's Bundura. Is where it's Bundura. Plenty Road, Bundura.
Three of the same brand, I think, in Bundura in terms of the EIC.
Okay.
So it's
Well,
the Plenty Road
you should Plenty Road, and you should be comforted to know that all the relevant parents and staff have already been contacted. So as effective as your messaging is, they won't need to watch the news to know, because we've already spoken to them. We've already spoken to them, and many of them are getting tested. In terms of the three cases, though, that's where Burundara is relevant. So there's Darebin, Burundara and Casey.
But the childcare centre is in Bundura.
Correct. Sorry if I wasn't clear with my...
November 8, when further restrictions are eased, are you expecting weddings to be able to have more people?
I can't be certain that we will do any more than we've already flagged. So we have flagged a number of increases in a number of different settings. I think it would be unwise to plan on us going further than that. But if the conditions allow, and again, it's not, I wouldn't say it's a iterative process as such, but we get a lot of feedback from lots of different people. I spoke to a number of CEOs last night, just getting a bit of a sense of how things were. Some people from the banks as well. Things are raised with us each day, and we try and work through those. I had the head of the VFF text me this morning about a couple of issues, and that's been actioned by my office today. So things can change and evolve, and sometimes they'll relate to settings that influence many people. Sometimes they'll be about much more confined to a dedicated set of circumstances. But that's why the open door and listening is a very important part of this.
Premier, really quickly, just back
Sure,
on
no
that
worries.
work that Mr Armitage's company has done. Would you be prepared to make the research that he's done public, given that taxpayers paid for it?
Cabinet in confidence documents are not made public, not by my government nor any government in the Westminster system. The arrangements will be reported, as they always are, whether it be our government or any other government, in the Department of Premier and Cabinet annual report.
Do you anticipate we'll be able to see out 2020 at a nightclub on New Year's Eve?
King Street.
Well, I'll boldly predict that I won't be at a nightclub on New Year's Eve. It's my wedding anniversary, so I won't be at a nightclub. And virus conditions will determine whether anyone else can be. I think it's fair to say that socially distanced clubbing would be challenging. And again, logic, you know, the notion of people, I think I spoke yesterday or the day before about, and I do not claim any expertise in this field, but the notion of a very, very long lunch or dinner, compliance with the rules, or perhaps time at one of those venues, the notion that you'd be as compliant at the end of your night as you were at the beginning, it's fair to say that probably wouldn't be the case. So we've all got to, and it's not, I'm not being flippant about it, that there are many people in that industry and they're doing it very tough, and that's why there's been significant support for elements of that industry who, because of the nature of the virus, a bit like gyms as well, they've had a unique challenge, and if there's more we have to do there, then we will.
Are you aware of any DHHS staff being stood down or fired for leaking documents?
They're not matters that I'm involved in. The Secretary of the Department would hire staff and would deal with any of those sorts of issues. They're not matters that I have any real say over. It's important though that departmental secretaries have those arrangements in place. I'll be confident they do. Any other issues?
When are you going to the pub?
I'm not sure actually, but at some point I will. Not today. No other issues? Very good. See you tomorrow.
Cheers.